Parents should be required by law to vaccinate their children. The Pediatric Academic Society reported in 2003 that vaccinations prevented 33,000 deaths. Although there is speculation of their safety, most studies advocating against vaccines are biased and misleading. Vaccinations continue to be proven safe and one of the greatest developments in healthcare in the 20th century. There are many risks related to not vaccinating our children. Preventable diseases like measles, mumps, and pertussis can cause irreversible disability and death. Mumps can cause irreversible hearing loss. 1 in every 1,000 children who get the measles will develop encephalitis, which is an inflammation of the brain that can cause permanent disability and damage. Pertussis can cause severe respiratory complications. Even when diseases seem to no longer exist, outbreaks can occur. So far in Texas, 2,062 cases of whooping cough, which is pertussis, have been reported, with 2 resulting in death. This is the worst outbreak in 50 years. This outbreak is attributed to the need for boosters in older children and adults to protect our more vulnerable infant population. Labor and delivery units are encouraging boosters of this vaccine in new moms. Another point to consider is that the cost of vaccinating our children is much less than treating the illness and its complications. According to the CDC, every $1 spent saves $6.30 on medical costs. There has been a huge increase in people who use government-funded health care. Vaccines can lower government-funded health care by preventing complicated illnesses. The cost of treating complicated illness can be detrimental to a family income, even if they have health insurance. Vaccinating our children provides not only financial benefits for our country, but it ensures the safety of others. Not vaccinating poses a health risk to other members of the community. It is important for us to vaccinate as many children as possible to protect the community. Studies have shown that depending on the vaccine, 75 to 94% of the population have to participate to create eradication of disease. The safety and effectiveness of vaccines cannot be disputed. The benefits continue to outweigh the risks. Parents should be required to vaccinate their children for their safety and the safety of others. Due to biased and misleading reports, parents are second-guessing the necessity of vaccines. This is creating a rise in the occurrence of what were once eradicated diseases. It is essential that we vaccinate our kids by 2 and maintain protection with boosters of specific vaccines to prevent disability, disease, and a rise in healthcare costs.